everyone. Hi, my name is Mama Deborah Samuel. I'm from Nigeria, and I'm a member of the PATH Resource Mobilization and Partnership Group. Family planning is very important. It's an empowering tool for adolescent girls and young women, also for young women to make their own choices and also have informed information on sexual reproductive health and rights. As a young person who is privileged to have this information of family planning, decided to walk to a healthcare facility to assess one method of the family planning. On her way getting there, she actually met a healthcare provider. But unfortunately for her, she knows that healthcare provider, and the reaction of the healthcare provider when she saw her was discouraging, was stigmatizing. She has to lie and she left the facility. Secondly, as a young person who is sexually active but is 14 years of age, have the knowledge about sexual reproductive health and rights services, about family planning, contraceptions, and all that, decided to walk into the healthcare facility to access condom. Unfortunately for that person, because of the person's age, he was not given that services without parental consent. And this young guy doesn't want his parents to know about his sexual behavior. So he decided to leave the facility without getting the services. Lastly, a young person who wants family planning services decided to walk into the facility to get the service. Unfortunately for that person, he was able to get that service but can't afford to get it. The person have to walk away because he don't have the money to get the service. What am I trying to talk about here? I'm talking about barriers young people face when accessing sexual reproductive health services and also family planning. How can we break those barriers? I have mentioned the issue based on my stories. 1 is poor access. 2, the availability. 3, is it affordable? Let's talk those 3 ways. Breaking those barriers. If we are going to break those barriers, then we have to work on our values. Let's allow young people to make their own choices. Let's respect their right and what they want. If a young person walks down to you to seek for those services, that means that young person is well informed. All he needs is for you to guide him and give him what he wants. It's left for that young person to make his or her own choice. Allow young people to make their own choice. Enough of all these judgmental attitudes. It's not helping young people, especially young girls. It's not. In this part of my country, Nigeria, it's really not. Let's talk about the universal health coverage. It's health for all. It covers everybody's health. At least a young person should be able to afford the service, or it should be free in order to get the services. It should be available. If you talk, you have family planning. It should be available. It should be available. Yeah, so I'm not the only one talking. I have my colleague who is going to talk about the youth-led action. What are they doing in order to bridge this gap, in order to break those barriers? So let's listen to Joy. Hi, Joy.
My name is Oboyi Joy, and I'm from Nigeria. There is still an unmet need to the access of family planning by adolescent girls and young women in Nigeria and globally. However, access to safe and voluntary family planning by adolescent girls and young women is a human right, and this is central to gender equality. Access to family planning empowers women and girls to make informed decisions about their bodily autonomy, as well as it reduces the poverty rate in families. In addition to this, several youth-led organizations have carried out advocacy trainings and capacity building for adolescents and young people, including adolescent girls and young women, on family planning and access to sexual reproductive health and rights. This capacity building and training has translated to building capacity of women and girls to become advocates, to become champions, to become role models, and to become feminists, and to push for their issues. This has improved the knowledge and awareness of women and girls on the uptake and access of family planning services. This has also contributed to maternal and child health in low and middle income countries that have limited access to quality healthcare services. In my own opinion, I would say these are little success stories because family planning uptake is still low and still an issue among adolescent girls and young women in certain or several countries. My keynote will be that in one voice, in solidarity, we can achieve the change that we want to see by 2030. Thank you.
Wow, Joy. Thank you, Joy. That's really a powerful one. Joy pointed out the importance of family planning, especially among adolescent girls and young women. That's really powerful, points she pointed out. She also talked about the youth-led organizations' actions, what they are doing in order to see the break down those barriers when it comes to accessing sexual and reproductive health and rights, and also family planning services. If we're able to come together, we'll be able to bridge this gap and we'll be able to reduce sexual transmitted infections among young people. We'll be able to reduce the new HIV infections among young people. And also, we'll be able to reduce teenage pregnancy among adolescent girls and young people, and young women, sorry. So that's really, a wonderful intervention in which we can do to push for these issues to be, solved. We want a change. We want to see a change. And we have to do something in order to make the change happen. Let's, bring in our voices. Let's speak for ourselves in order to see those changes happen for our own good, in order to stay healthy. Thank you for watching. Watching, listening, wherever you are. I appreciate everyone for listening. As I think we come to the end of those sections, and I believe we enjoy these sections. So bye, have a wonderful day.